Welcome back to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Today, we're tackling a hot topic, Ozempic. You've heard the hype, weight loss, blood sugar control, even celebrity endorsements. But what's the real story behind this drug? Stick around because we're breaking down the side effects, the science, and most importantly, who should and shouldn't be taking it. Let's dive in. Segment 1. What is Ozempic? At its core, Ozempic, known by its generic name semaglutide, is more than just another diabetes medication. It's a carefully engineered injectable drug, approved specifically for managing type 2 diabetes, that taps into your body's own biology to help control blood sugar. But how does it do that? To understand, we need to look at the science behind it. Ozempic belongs to a class of drugs called GLP-1 receptor agonists. These medications mimic a natural hormone in your gut known as GLP-1, short for glucagon-like peptide 1. Normally, this hormone plays a key role in regulating blood sugar, but in people with type 2 diabetes, that system doesn't work as well as it should. Ozempic steps in to help in 3 crucial ways. First, it supercharges your insulin response. When your blood sugar rises after a meal, Ozempic signals your pancreas to release insulin, the hormone that helps shuttle sugar out of your bloodstream and into your cells where it's needed for energy. This keeps your blood glucose levels from spiking too high. Second, it slows things down. Ozempic delays stomach emptying, which means food stays in your system longer. This not only helps prevent rapid sugar absorption, but also keeps you feeling full, reducing the urge to overeat. And that leads us to the third effect, appetite suppression. Ozempic talks to your brain by targeting receptors involved in hunger and reward, which dials down cravings and helps you eat less. This is a factor in why Ozempic has gained so much attention beyond diabetes treatment. It's been prescribed off-label for weight loss, and in higher doses, it's even FDA approved under a different name, Wegovy, specifically for obesity. But make no mistake, Ozempic itself is not a weight loss drug by design. It's a diabetes medication, and its primary job is blood sugar control. Another key thing to remember, Ozempic is not insulin, and it's not for people with type 1 diabetes. It's meant for type 2 diabetes patients, typically prescribed alongside lifestyle changes, better eating habits, regular exercise, to maximize its benefits. The injection is given just once a week, making it a convenient option compared to daily medications. But with all its benefits comes a big question. What about the side effects? Because while Ozempic can be a game changer for many, it's not without its downsides. Segment 2. What are the side effects? Ozempic can be a powerful tool for managing type 2 diabetes, but like any medication, it comes with risks. While many users adjust to it without major issues, others face side effects that range from mildly uncomfortable to potentially severe. So, what should you expect and when should you worry? Let's start with the most common reactions. These usually hit early, often fading after a few weeks as your body adjusts. The big one? Nausea, affecting about 1 in 5 users. For some, it's just a fleeting discomfort. For others, it's persistent enough to make meals a challenge. Then there's the digestive tug-of-war. Diarrhea for some, constipation for others, sometimes even cramping or stomach pain. And because Ozempic slows digestion, that stuffed feeling can tip into fatigue, leaving you drained as your body adapts. But beyond these temporary struggles, there are rarer, more serious risks. Take pancreatitis. A sudden, searing pain in your abdomen could signal inflammation of the pancreas, and that's a medical emergency. Hypoglycemia, or dangerously low blood sugar, is another concern, especially if you're already on insulin or other diabetes meds like sulfonylureas. Then there's the domino effect of dehydration. If nausea or diarrhea leads to fluid loss, it can strain your kidneys. And though it's uncommon, Ozempic has been linked to gallbladder issues in some patients. The bottom line? Ozempic isn't one size fits all. If your body protests, whether with stubborn nausea or something more severe, don't shrug it off. Talk to your doctor, because managing diabetes shouldn't mean ignoring the signals your body sends. Segment 3. Who should use Ozempic? Ozempic isn't a one-size-fits-all solution, but for the right person, it can be transformative. So who stands to benefit the most? Let's break it down. Type 2 diabetics, who've tried lifestyle changes or other medications, but still struggle with high A1C levels. If diet, exercise, or metformin haven't been enough to rein in your blood sugar, Ozempic could be the missing piece, helping your body respond more effectively to glucose. Those with both obesity and diabetes with a BMI of 27 or higher and with weight-related conditions. Ozempic's dual action, curbing appetite while improving insulin sensitivity, makes it a standout for people battling both issues. It's not just about shedding pounds, it's about reducing the strain excess weight puts on your metabolism. Patients who need cardiovascular protection. Ozempic has been shown to lower the risk of heart attack and stroke in certain high-risk individuals. For diabetics with existing heart disease, that's not just a bonus, it could be a lifesaver. But Ozempic isn't for everyone. Who should steer clear? Type 1 diabetics. This drug isn't insulin, and it won't replace the insulin your body can't produce. Relying on it alone could be dangerous. People with a history of pancreatitis or thyroid cancer. If you've had pancreatitis before or have a family history of medullary thyroid cancer, Ozempic's potential downsides may outweigh its benefits. Pregnant or breastfeeding women. There's just not enough data yet to confirm it's safe for developing babies or infants. The key takeaway? Ozempic is a powerful tool, not a magic shot. It works best when paired with healthy eating, consistent exercise, and regular blood sugar monitoring. Think of it as a teammate, not a solo player, in your long-term health journey. Final thoughts. Ozempic can be a game changer for type 2 diabetes, helping lower blood sugar, curb cravings, and even protect your heart. But like any medication, it's not one size fits all. Here's the bottom line. Timing matters. While some see blood sugar improvements in weeks, full effects, like weight loss, can take months. Patience is key. Cost and access. Insurance coverage varies widely. Check with your provider to avoid sticker shock. Not a forever fix. Stopping Ozempic can lead to rebound weight or A1C rises for some. That's why pairing it with diet and exercise is non-negotiable. How it stacks up. Other GLP-1 drugs, like Mounjaro or Trulicity, may or may not be a better option for you. Your doctor can help compare options. At the end of the day, Ozempic is a powerful tool, but knowledge is power too. If you're considering it, talk to your doctor, weigh the pros and cons, and remember, managing diabetes is a marathon, not a sprint. Drop a comment below. Have you tried Ozempic? What was your experience? We'd love to read your comments. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.